I'm Ann Curtis. I'm SUNY Distinguished Professor and Chair of the Department of Medicine at the Jacobs School of Medicine and Biomedical Sciences at the University at Buffalo in Buffalo, New York. I just presented today at the International Academy of Cardiology's 2017 Scientific Sessions in Vancouver, British Columbia. I talked today about improvement in quality of care of patients with atrial fibrillation, the Get With the Guidelines program. There are many quality improvement initiatives that have been done in order to help improve the quality of care with patients with a variety of different conditions. The Get With the Guidelines program is a program that has been put together by the American Heart Association that has helped to improve the quality of care of patients with conditions such as stroke and heart failure. The Get With the Guidelines AFIB program is a program that is specifically designed to help improve the quality of care of inpatients who are diagnosed with atrial fibrillation. So just as with the other Get With the Guidelines programs, this is an inpatient program, and hospitals across the United States have been encouraged to enroll their patients. We currently have over 79 institutions in the United States, and currently over 20,000 patients are represented in this registry. And it's more than a registry. It is a quality improvement program by which patients are entered into it, and by means of various educational activities such as webinars and instruction on the guidelines, the providers and other people who take care of patients at these hospitals have been instructed on the best quality care under current guidelines. Patients are enrolled in the program, and we look at things such as demographics and their current treatment with respect to things like their underlying cardiovascular condition, as well as rate and rhythm control in atrial fibrillation, and very importantly, antithrombotic therapy. And to that end, one of the things I presented today were the early results from the Get With the Guidelines program that did specifically look at anticoagulation therapy. So we looked at patients who were, what their CHA2DS2-VASc scores were, and in the Get With the Guidelines program, the mean score is 4, which means that these inpatients are very high risk for stroke. And then we looked at how many of them are actually being treated with anticoagulation, whether it's warfarin or one of the direct oral anticoagulants. We found that at the beginning, about 85% of the patients who didn't have any contraindications were being treated with anticoagulation. And through this iterative process of quality improvement, by the end of the 3-year follow-up period to date, we now have close to 96% of the patients who are being properly treated. So what we've demonstrated is the ability to improve the care of patients with atrial fibrillation, that a quality improvement project such as the Get With the Guidelines program can be effective, and we will continue to do this looking not only at anticoagulation, but other aspects of the care of patients with atrial fibrillation.